If you're trying to conceive and dealing with thyroid issues, this session is for you. Namaste and welcome. I'm Dr. Anupama Santosh, your most trusted Ayurvedic fertility expert, helping couples reclaim their power of natural conception. Today, we are talking about a connection that's often ignored or misunderstood. That's the connection between your thyroid and your fertility. Many women tell me that yes, I take my thyroid medicines very regularly, so I should be fine, right? But here's the truth: even with normal TSH levels, thyroid dysfunction can still interfere with ovulation, egg quality, and your cycle's rhythm as well. Let's uncover how Ayurveda sees this connection and what you can do to support both your thyroid and your fertility. Did you know that 2 to 4% of Indian women have hypothyroidism and many probably don't even know about it? Even more women are in the subclinical range where the thyroid labs are within range but still not optimal for fertility. Normal is not enough, we need optimal levels. This can result in anovulation, that is, no ovulation, low quality eggs, irregular or delayed cycles, higher miscarriage risk. So, yes, it's a silent disruptor. That too for women who are already taking the thyroid tablet, they will not realize that it's especially for women who are trying to conceive, they'll not realize that this may be one of the contributing factors for them not being able to conceive. In Ayurveda, thyroid imbalance is usually related to a disturbance in kapha and vata doshas combined with the agni and the accumulation of ama, which you can call as toxins. We also pay very close attention to the health of the rasa and the shukra dhatus, that is your body's nourishment and reproductive tissues. If these are depleted or blocked, conception of course becomes difficult, even if your labs look fine and normal. That's why Ayurveda doesn't just treat your blood report. We treat you as a whole person, mind, metabolism, hormones, all in harmony. For women trying to conceive with thyroid imbalance, Ayurveda offers a deeply holistic, individualized path to healing this and support your fertility. Here's how we can do that. Number one, by balancing your Agni, which can be loosely translated to your digestive fire. Have warm, spiced as in gentle spices, easy to digest meals. Avoid cold, raw, and heavy foods, which can slow metabolism. And reduce your ama by doing gentle digestive detoxes through diets and herbs. Specific Panchakarma therapies to reset your thyroid and other hormone and metabolic balance, and then nourish your ojas and thyroid regulation with herbs. Always these have to be prescribed based on your dosha and prakriti and your current state and never be taken blindly. A word of caution here: there is no single thyroid medicine in Ayurveda. I see many thyroid patients just taking Kanchanara Gugulu without their Ayurvedic doctor's advice because of the advertisements. Always make sure to check with your Ayurvedic doctor before starting any herbs of medicines, especially if you're on your fertility journey. It becomes very important because not they may not be suitable for your prakriti and it can cause side effects. Let me share three mind body healing tools. These are basically yogic practices which support both mental calm and thyroid stimulation. The first one is Bhramari, which is like a humming bee breath work. It calms anxiety, stimulates the vagus nerve and the throat chakra. Next one is Ujjayi. It builds up proper metabolic heat, balances the vata, and supports the hormonal flow. There is another one called Jalandhara Bandha, or a throat lock, which gently stimulates the thyroid gland, improves blood circulation, and also hormonal signaling. These help shift your body from survival mode into a receptive, fertile state where real healing and conception can happen. Now, a really important note for anyone on thyroid medicines. Your TSH levels may come back normal on paper, but you may still be feeling exhausted, anxious, irregular, and struggling to conceive, struggling to lose weight. This is why Ayurvedic diagnosis does go beyond the numbers. We look at the quality of your periods, your digestion, your skin health, your mental health, your energies, sleep, skin, and the general emotional state as well, because it could be because of the thyroid dysfunction and your overall reproductive rhythm. Because fertility is a whole body conversation, not just about one hormone. And if you're trying to conceive and your thyroid is a part of this puzzle, please know this, you're not broken. You simply need support that sees all of you together. If you know someone with thyroid and fertility challenges, share this live with them. Follow Fertility Ayurveda to keep learning how to heal naturally, gently, and holistically. Let's bring light to the silent links to fertility and guide more women towards joyful and supported conception. Namaste. I have a question here. Can you please talk about AMH levels, ma'am? Um, I have spoken about AMH levels in multiple Insta lives before. You can find it on my feed. I will I will also speak about it again. Just in one line, what I'd like to say is that just a low AMH does not measure your fertility. Please do not go by it, because there's a lot of talk about how only low AMH is equal to IVF or no natural conception. That's not possible. You can see the more detailed live on my feed about AMH levels. We have in Shrestha Ayurvedic Center, I have treated patients with AMH as low as zero point 0.1, and we have found success. I'm not saying all cases can be successful, but what we need to understand is AMH is not that single point, single value with which we can measure your fertility. Okay. Any other questions? Okay, then meet you next week. Please feel free to send us a DM if you have any specific questions. Do look at the long format videos, reels and on fertility.ayurveda. We have plenty of them, talking about AMH, PCOD, endometriosis, and many other things. If you have any specific questions, do DM us. Thank you.